MRI in the lid with the red arrow pointing to where the mass is. It's really pushing the eye sideways. Um, Intralesional cisplatin, everything undergoes necrosis, and then eventually it actually tests really well. Uh, but I'm not big on sarcoids. This is a interesting type case. This was a really young horse, first time horse owner, and has all these fluctuant masses on its face. And if you push on it, the area depresses, and you take your finger off, and it fills back up, suggesting that there's fluid there, obviously, and turns out to be blood. Um, these turned out to be congenital hemangiomas, and we were so desperate to we actually used leeches on them, medical grade leeches. You can buy them on the internet, of course you can. What really seemed to help, our leeches weren't hungry, so they didn't do too much except give us a couple good pictures. But intralesional triamcinolone is what got this better. It had hemangiomas on the eyelid, on the nasal, inside the nose, on the inside of the lip, all in the same side. And so this is kind of an interesting thing, but haven't seen one since. This was 1999. Just one last thing to mention about tarsorrhaphies, temporarily suturing the lid shut. And there is something I've wondered about for a long time. When a horse is painful, what do? They do a tarsorrhaphy on themselves, right? They squint. And yet things sometimes progress despite the squinting, don't they? If you increase the if you have an ulcer, a corneal ulcer, and you increase the contact between the eyelid conjunctiva and the ulcer surface, what you're doing is putting blood vessels in the conjunctiva adjacent to the ulcer. The ulcer is emitting the damaged tissue in the ulcer is emitting cytokines, which are causing recruitment of neutrophils, and it seems like doing a tarsorrhaphy is making it easier for the neutrophils to leave the blood vessels in the lid and just move into the cornea. And I'm not saying not to do tarsorrhaphies. I do them, but I also release them fairly quickly. I don't just walk away and not see them again for a couple weeks. Tarsorrhaphies are routinely done. I'm not saying not do them either. I just want everybody to think about it. Usually, even things we do commonly, we should probably re-examine them. Third eyelid flaps, same idea. You're pulling the third eyelid conjunctiva up and putting it adjacent to a wound on the cornea. You can see in this picture, I got the cotton swab in there so you can see the sutures. We're using stents to take some of the pressure off the lid margin. I generally anymore use I use a knot, like a shoestring knots, to tie this tarsorrhaphy sutures down, and then when we do that, then we can release it and then pull it back down, put it back in place. Just a thought.